Good afternoon, everyone. My name is Elena Dato. I am a PhD student and clinical psychologist at Bologna University. So now I will move to a more clinical perspective. The study that I'm presenting today is part of an interdisciplinary research project on foods, which is aimed at promoting more sustainable diets. And it brings together networks of universities, research institutions, and companies. And as clinical psychologists, our first aim is to understand which psychological factors may affect sustainable diets, both in healthy individuals, but also in clinical populations, including patients with obesity. We did know that obesity is a global health emergency affecting around 16% of the general adult population. And its impact are both at the individual level, but also at the environmental level. On the one hand, obesity is associated with a number of medical diseases, such as diabetes, cancer, hypertension, but also the number of psychological comorbidities, the most common being depression, anxiety, and eating disorders. However, there is also an important impact at the economic level, especially due to the high costs related to long-term treatments, which are often needed in this clinical population. And also there is an important impact at the ecological level, especially for the food waste due to the overconsumption of food beyond what is actually needed by the person in terms of nutritional needs. And if we look at the numbers, we will see that in the last decades, obesity has more than doubled. It is expected that by the end of 2030, more than 1 billion adults globally will be affected by obesity. And it has been also highlighted how this increase, this alarming rise in obesity rates seems to be partly due to the increase in the production of cheap and highly palatable foods, the so-called ultra-processed products. And also the consumption of these unhealthy and non-sustainable diets also poses a risk at the environmental level due to the overuse of resources. However, despite the role that non-sustainable diets have both for the development and the maintenance of obesity, the promotion of more sustainable diets is not part of the guidelines for the treatment of this clinical population, which usually recommend to combine lifestyle modifications, mostly in terms of promotion of healthy eating and physical activity, with medical interventions. And yet many patients fail in achieving treatment goals and in maintaining weight loss, which suggests that the combination of these elements, maybe it's not enough to effectively treat patients. And we also know that there are a number of psychological factors that act as barriers to behavioral change in general, but in this clinical population in particular. We know, for example, that unhealthy eating behaviors are strongly associated to psychological distress and also to dysfunctional eating patterns, such as emotional eating and external eating, which are often used as strategy to deal with this psychological distress. And if on the one hand, these eating behaviors may lead to an immediate sense of gratification and pleasure, if we look at the psychological well-being level of this clinical population, we will actually see that there are some really compromised levels of psychological well-being. And in order to work on these psychological mechanisms, several psychological interventions have been tested in these clinical populations. First of all, cognitive behavioral therapy, which has been proven to be effective in reducing distress, but also negative thoughts and emotions. And recently, wellbeing therapy, which is a psychotherapeutic strategy aimed at promoting a positive psychological functioning, has also been found to be effective in patients with obesity. And of course, also nutritional education is needed in order to promote behavioral change towards a healthier lifestyle. So based on this evidence, we designed a randomized controlled trial, which was aimed at testing the effect of a psychological group intervention, which was based on cognitive behavioral therapy and well-being therapy, together with a healthy and sustainable eating education that we compared to healthy eating education alone. And we recruited 50 patients with obesity. We had different inclusion and exclusion criteria, but the most important thing is that patients had the BMI was above 30 or above 30. And we assessed patients during 4 time points, as you can see here. Our primary outcome was weight loss in terms of reduction in BMI, and we were also interested in assessing changes in sustainable eating behaviors and psychological functioning, both in terms of psychological well-being and dysfunctional eating styles, including emotional eating, external eating, and restrained eating. So patients were randomly assigned to either the experimental group or the control group. So the experimental group received a healthy and sustainable eating education, which was held by a trained dietitian, and a psychological intervention held by a trained clinical psychologist. And they were also asked to fill in a nutritional and emotional diary, while patients in the control group only received the healthy eating education, and they only filled in a nutritional diary. Group differences were analyzed through mixed effect models, in which we included the main effect of time, group, and their interaction, and we followed a stepwise backward procedure, and we also included the individual baseline as a covariate in all the analysis. So moving to the results of our first outcome, which was BMI reduction, as you can see in table 1, we found a significant effect of time. And when we looked at the post-hoc statistics, we found that in the experimental group, there was a significant BMI reduction from the baseline to both the 1 month and the 3-month follow-up, while in the control group, we all observed a decrease from baseline to the 3-month follow-up. In terms of sustainable eating behaviors, we found a significant interaction between group and time, as you can see here. And specifically, we observed in the experimental group an increase in sustainable eating behaviors during all time points. So both at post-intervention, but also during the 1 and 3-month follow-up. In terms of psychological functioning and specifically dysfunctional eating styles, we found some changes in external eating, and also in this case, we observed a significant effect of time. And looking at the post-hoc statistics, we found a significant decrease in external eating scores from baseline to the 1-month follow-up in the experimental group, while we didn't observe any change in the control group, as you can also see from the figure. And in terms of psychological well-being, actually, we didn't find significant differences between the groups. However, I found this result particularly interesting in the dimension purpose in life. As you can see here, we didn't find a significant effect for time, but we looked at the post-hoc statistics, and we still observed that there was a significant increase in purpose in life score in the experimental group from the baseline to both the post-intervention and the 1-month follow-up. So based on these findings, we can highlight some key benefits of our experimental intervention. The most remarkable findings was the improvement in sustainable eating behaviors. In fact, this was the only outcome in which we observed a significant interaction between group and time. So we can actually say that the changes that we observed were a direct effect of the intervention that we delivered. And more specifically, we found a significant increase of sustainable eating behaviors, both in terms of food choices. So, for example, choosing seasonal and local foods, but also in terms of sustainable eating behaviors overall. So, for example, avoiding food waste. And as per weight loss and psychological functioning, the changes that we observed were mostly an effect of time. So we cannot conclude that our intervention was better than the control intervention, but we observed some positive changes that might be interesting for also future studies. And specifically, we found a more rapid and sustained BMI reduction in the experimental group as compared to the control group. And in terms of psychological functioning, we observed an improvement in terms of having life goals and a sense of directedness in the experimental group, which is the dimension purpose in life, but also some improvements in terms of eating behaviors, and more specifically, patients reduced their external eating, which is the tendency to eat in response to external cues, such as seeing other people eating or having food in front of them, rather than physical hunger. Of course, there are some limitations that need to be highlighted. First of all, the short follow-up, which limit conclusions on long-term effects, which we know that is one of the biggest challenge in this type of clinical populations, because we know that usually patients improve right after treatment, but then the most challenging part is the maintenance. Then also the fact that we used that behavioral data were based on self-report measures, and we know that there are a number of biases associated with this type of measures. And also the small sample size, which although for the purpose of this study, which was a sort of a pilot study, was adequate, and we also assessed it through power analysis before starting the study. Despite these limitations, I think that our results are clinically interesting, and especially they highlight how multidisciplinary interventions integrating psychological and nutritional components, and more specifically with a focus on positive psychological functioning and the promotion not only of a healthy diet, but also a more sustainable and ecological diet may support lasting improvements in both mental well-being and nutritional health in these patients, as compared to the traditional interventions, which mostly focus on the promotion of healthy eating and eating education. So thank you for your attention. I think I was on time. Yes.
Yeah, very interesting effect. I was also surprised that you find an effect, considering that it was an intervention that would fit them all in a sense. So there was no tailoring, right? And then I was thinking whether you are considering as a follow-up to some degree tailoring this intervention, because it's already very promising. And already, and also if you have ideas, maybe you discuss already with your group how to tailor it.
Yeah, could be interesting. And also, I mean, I didn't show it here, but I think there is also a very interesting part, and also some interesting information coming from the food diaries and the emotional diaries, which actually give us also some qualitative data, which we did not analyze because this was not part of the project. But I think maybe also, I don't know, if we want to personalize this type of treatment, also using those type of information might be really of interest, because in that case, you can actually see what patients really need. And of course, they all need also different things. But what I, for example, noticed while talking with patients is that they really missed this part, like of the integration between the psychological intervention and the nutritional intervention, because at least in this hospital, they were mostly treated through eating education, but still they were seeing that another part was missing. So I think it's promising. Yeah, we don't have we didn't plan a follow up yet, but yeah, maybe it might be interesting to do it.
It was focused mainly on body-related arguments and eating habits, or it's a more general cognitive behavioral therapy.
Well, so first of all, the intervention was pretty short. It was 1 month, and it was 6 sessions. So we provide like a more general cognitive behavioral therapy intervention, but especially also like for the diaries, we like patients like they could talk about eating behaviors, but also some other daily lives situations, also because we know that sometimes eating behaviors are related to other situations in daily life, as we were saying before, also due to stress, that maybe it's completely unrelated to, so maybe there is an eating behavior, but it comes for, I don't know, maybe you have an argument with your partner or something like that. So it was not really focused on eating behavior, so it was a more general one. But then, of course, we were talking a lot about eating behaviors because that was the point. But yeah.
Maybe you mentioned a really nice study. maybe you mentioned it, but did you had the chance to look at physical outcomes? For instance, glucose measurements like these.
Unfortunately, no. But that's why also this morning I was like really interested because it might be interesting to put everything, combine everything. Unfortunately, it was really hard to do it. It was already a lot to do this because unfortunately we didn't have the right connection maybe. But it might be interesting to do that.
Definitely. Thanks a lot.
Thank you.